this week's show, we go virtual. There has been a lot of innovation in health recently, and on the show this week, we focus on one such innovation, Sila Health.
The global community is racing to slow down and halt the spread of COVID-19. Globally, the virus has spread to 150 countries, and from Angola to Zimbabwe, they have shut down and totally banned social gatherings so as to limit the spread of this epidemic. Some of these African countries have started virtual learning programs so as to disseminate information to health and community work. Welcome to this week's show, The Tech Garage. I'm your host, Sean. And in this week's show, we speak to Babusi Nyoni, the founder of Triple Black Agency. He'll walk us through and tell us more about Sila Health. Who is Babusi Nyoni?
Babusi Nyoni is a self-taught Zimbabwean innovator who's focused on the uses of artificial intelligence on the African continent. I've done a lot of work in the artificial intelligence space. I think particularly in 2016, I created what Forbes magazine called the world's first football commentator for the UEFA Champions League final. And since then, I've worked with the UNHCR Innovation Agency, and I've worked on my own personal projects as well within the AI space, specifically for African people.
Can you give us a brief overview of Triple Black Agency?
So Triple Black Agency is an agency I founded, and it's a digital innovation and product development company focused on removing the barriers to the creation of new technology, and we're headquartered in Amsterdam with an office in Cape Town, and we build solutions that translate to groundbreaking technologies to a spectrum of user types using a human-centered design approach. And basically what that means is that we are able to work with emerging technology and make it understandable to people for everyday usage, and particularly African people. And this enables us to provide solutions for clients including UN arms, advertising agencies, and government departments, and mostly using artificial intelligence as a technology base.
I see you have a diverse group of people you're working with at Triple Black Agency. How is it important when it comes to networking and collaborating to create interesting and amazing products?
It's pretty important because I think the thing that sets us apart is our ability to translate the super complicated and technical into something that is very accessible. So I met our Chief Technology Officer, Rob, while working on another project in Cape Town, and he's someone who understands a variety of technologies and is able to work in a way that basically allows us to work with bleeding edge tech very quickly and in a very nimble way. And I met Natalie Dixon in Amsterdam, but she's actually a South African, and she heads up the research for the agency.
So the coronavirus happens, and then Sila Health is born. What made you come up with this idea of creating Sila Health?
So Sila Health is an idea that has been floating in my head for close to 10 years now. I always had this idea of trying to digitize the doctor-patient experience in African countries. But I guess at the time that I thought about it, the barriers to entry were pretty high, and a lot of the technology that would be necessary in order to carry this out successfully was non-existent. And I finally had some time in 2019 to really sit down and figure out what would be a solution that can work within the African context as it stands right now to help bridge the gap between Africa's doctors and its patients, which sometimes can be 1 to 50,000. And I found that natural language processing, which is the arm of artificial intelligence that deals with the way computers understand the way humans speak, had made great strides, and this was something that we were able to pick up and create a product around, which could be accessible on chat platforms. So that's your WhatsApp, that's your Facebook Messenger, that's your SMS, but also be able to work on those platforms as if it belonged there. And we worked on building it, that's myself and Rob, in August, and in September we were finally able to launch. So,
Right.
yeah, it kind of feels like we just came out of the blue. during the coronavirus crisis, like at its peak. But we built this in the hopes of helping people access healthcare remotely, while also enabling governments and organizations to have a bird's eye view of what is happening in very remote areas in terms of the rise of symptoms and symptom trends, and how best to allocate resources to people who previously would not be accessible at such a scale.
With the advent of the coronavirus, many chat apps have popped up from the World Health Organization and one from the Ministry of Health and Childcare. What sets Sila apart from these other apps that have been introduced so far?
I think for us the trick is that we already existed as a solution for the access of healthcare on chat platforms. So the COVID-19 assessment was something that we just added to our toolkit for healthcare access in sub-Saharan Africa. So what we already had was doctor-patient conversations via chat. We had the artificial intelligence enabled triage tool, which used like your normal conversation. So you can just tell it, I have a headache and I have a fever, and it can pick up what exactly it is that you might be suffering from your conversational exchange. And then we also had a term lookup service as well. So there are things such as MRIs that not that many people know, but that are part of a holistic diagnosis or recommendations for next steps. And we noticed that a lot of people who were using our service across Africa would ask about these things. So we built a way to look up medical terms from online repositories. And we introduced the COVID-19 assessment, of course, because of the pandemic itself. And what sets us apart from other solutions that might exist, like you mentioned, like the World Health Organization and all that, is the fact that we partner with local governments in order to assist them to understand the spread of this pandemic, because we have data that can be used as a proxy for the actual rate of infections, and to also assist with contact tracing. Because we're able to work on such a granular level, we're not just equipping you with a questionnaire that people can fill out remotely and whatnot. We're able to allow you to look at who might have this pandemic and how many people they live with, in order for governments to make informed decisions on how to allocate resources in those specific areas. And then also we're able to disseminate information such as where to go in case you are infected, so that people, one, don't go to hospitals where they might clog up the systems and also might infect other people as well. We are able to disseminate this information remotely, and remotely is key here as well, because we're able to, I guess World Health Organization can do so now, but we were among the first to disseminate this kind of information and give this kind of access to healthcare on these kinds of platforms, with the hope of getting to the place where everyone is trying to get to at right now.
Where and how can one access the Sila Health platform? And do I need to pay for it?
Okay, so that depends on what your objectives are. So if you're feeling unwell, for example, and you would like to access one of our products, you can either search for Sis Joyce on Facebook. Sis Joyce is the mascot that we use. It's the personification of the AI that we have as it exists on Facebook Messenger. So just open Facebook Messenger and search for Sis Joyce and it'll pop up. Or if you would prefer to contact us via WhatsApp, you can just send hi to +31 686 251 I'll just say that again. It's hi, just send hi to +31 686 251
Congratulations, you've hit 500,000 messages exchanged on your Sila Health platform. My question is, where are all these users coming from? And who are your main users? Are they all from Africa or Zimbabwe?
Thank you very much. Yeah, the 500,000 is a really big milestone, especially considering the fact that we're self-funded. So everything that has gone into building the product and scaling it out has been something that has been a very informed and measured response to what people need, and also what we're able to build and at what pace as, a self-funded organization. And Our users are, I think our largest user base is in Zimbabwe, followed secondly by Nigeria, and then Kenya, and then South Africa. But we have users in over 45 countries right now around the world. But we have a particular focus on 8 African countries. So that's where we actually have concerted efforts in growing our market base and understanding as well the needs of users in these places so that we can optimize the product. So it is optimized for people specifically in those 8 countries.
We come to the privacy and data protection of the users of the Sila Health platform. What measures has Sila Health put to protect the privacy and data of your users?
So from the beginning, when we started with our product development, we were very explicit about how we do not want to hand any personal identifiable information. So we will never ask you for your name, and we only ask how old you are, not what your exact date of birth is, for example. We won't ask what your actual physical address is, even with the COVID-19 assessment tool, where that might actually assist governments to, try and get to you. We, as a platform, do not want to collect any information that might compromise the privacy of the people who use the platform. And this is important for us because we are first movers in this market, and because we're first movers, we have the luxury of innovating faster than policies can be created in order to regulate our movement. So it's an ethical decision for us to ensure that the people who we are trying to help do not have their rights and liberties taken advantage of while trying to access something that is actually their human right. We instead focus on collecting anonymous information that will then help the people who provide access to healthcare for these individuals make better informed decisions. And we store this information securely, and it is encrypted. And when we do provide API access to NGOs and governments, all they see is literally cough 3, headache 4. So it's no one. We've worked very, very hard to ensure that no one should worry about their privacy being compromised while using the platform. And this does not mean that we don't run into snags. So an example of this is when trying to scale in Nigeria, it is extremely hard to collect even basic information that allows us to, provide gender-specific assessments, for example, to people because of the prevalence of online scamming in that particular country. So there are some things that are geographically specific that we have to navigate in the way that we collect data, because there's some things that we take for granted that we can ask in Zimbabwe, for example, that we definitely cannot ask in Nigeria. And we have to then, figure out how we can optimize our experience in order to reduce this friction point, which is necessary in the provision of healthcare, but also is one that might just deter people from doing the same.
I see you in partnership with the City of Bulawayo. How did the partnership come about, and how does it benefit the residents of Bulawayo?
So the partnership with the City of Health came because we'd already built the service, as mentioned before, in a way that it was able to plug in directly into any healthcare ecosystem for any government. And there's this super popular phrase or idiom that charity begins at home. And as a Bulawayo son myself, it made complete sense to start in Bulawayo and see what kinds of synergies we can bring out between ourselves and the city fathers, and look at ways that we can partner in order to spread information as quickly as possible to the people who need to hear it the most, and then also allow the city to plan and have a much more better informed response than, for example, actually I won't say any examples here, but allow them to have an informed response in terms of potential COVID-19 cases in lieu of the availability of testing kits. which we know are scarce, which we know have to be used sparingly and when the situation absolutely demands it because of just the prevalence of the prevalence thereof. And we came to an agreement to co-promote our chatbots on both WhatsApp and Facebook Messenger. And we also tailored our service to disseminate information that is specific for Bulawayo residents, especially if someone is identified as having or potentially having COVID-19, in order for the hotlines, for example, to be surfaceable immediately without someone having to try and go to the Bulawayo City Council Facebook page or try and bring up an old newspaper or something. And it's been going pretty well. We've been seeing trend-wise a correlation between what is showing up in our COVID-19 assessment versus the cases that actually come up after testing. So it's a partnership that we're really proud of in terms of what we were able to bring to the table.
Mobile health is booming right now. What role can Sila Health play in helping improve the health service delivery in Zimbabwe and in Africa in general?
We can definitely plug the gaps between policy formulation and actual last mile healthcare delivery. And we can do this only through partnership with government players. So I think the approach that we used with the City of Bulawayo, for example, is one that we would like to replicate in other places. I think it can easily sit in, for example, in the Gwanda rural district council, for example. There's lots of local government bodies that are as agile as the City of Bulawayo that we can partner with in order to replicate the success there.
With the advent of the fourth industrial revolution, people are worried that machines and AI will take over their jobs. In the case of Sila Health, if it becomes successful, will Sila Health render health workers obsolete?
I definitely don't think it will render health workers worthless or anything. I think it's just a different way of working. So our platform, when we started out, we just had an Excel spreadsheet with possible questions and answers, and then we plugged people directly into communication with a healthcare professional. And the only limitation to us connecting every single patient with a doctor is the number of doctors that we have available. So what we're trying to do is to limit the load on our healthcare professionals while trying to assist everyone as much as we can, considering our limitations as well, because it is just artificial intelligence. It's artificial at the end of the day. But Sila Health it's a platform, especially for healthcare workers, to connect with patients remotely. So it's just, assume you didn't have to go to work and you could just do part of your job at home. You can do a symptom triage remotely, assess what might be a rash, ask someone to cough into the microphone and send you a voice note. There's things that we're able to do now with the technology that exists the way it does today that should actually change the way we look at traditional concepts like healthcare delivery. Like, what does it mean to be a doctor in 2020? I think the pandemic definitely made people shift very quickly into the future. So I'm hoping that when we do emerge from this, we will start to embrace more of these technologies and not be scared of them, because we've seen from this crisis that they can be great enablers as well.
You spoke about the patient ratio being 1 doctor to 50,000 patients. How important is machine learning and artificial intelligence in the fight to improve health service delivery in Zimbabwe and Africa in general?
Machine learning allows us to provide some semblance of healthcare at scale. So a lot of our, I won't call them competitors, but a lot of solutions that are kind of similar to ours in the field are not AI enabled. And because of that, if you just go to the downloads page, it's like 5 to 10 downloads, for example. and the user bases are like usually in the hundreds, because it's hard to connect every single person to a doctor. If you're trying to do that, you either have very long waiting periods, and then that means the quality of your product starts to go down. People don't really, depend on it as much as they would like to, considering the fact that it's available on the internet, and we already have behaviors that have us accustomed to getting what we want whenever we want it right now on the internet. So machine learning enables us to scale our product very widely, and machine learning specifically on chat platforms such as WhatsApp and Facebook Messenger means that we're able to go to places that lots of players who are trying to get into the market or who are starting out in the market are not able to go to. We're able to go to rural Gwanda and supply our machine learning solution there in a way that people there will understand, and take that same thing to Abuja, for example. So I think we have a perfect cocktail of all these emerging technologies, but because we build with people in mind first and foremost, it doesn't even feel like it's all this tech. As far as you're concerned, you're just using WhatsApp to chat with this entity that might be human or not. You never know.
We reached out to Sila Health's partners, the City of Bulawayo, and we spoke to the Public Relations Officer, Mrs. Ndlovu. She tells us more about their partnership.
As a city, just like the rest of the world, we are faced with the COVID-19 pandemic, which firstly is a global pandemic, but secondly places a very large demand on information. It is our mandate to ensure that our community has access to accurate information about COVID-19, but are also able to get this at the comfort of their home. We know that Bulawayo, like the rest of the world, is now technologically based. And to this end, we've been working with Sila Health, which is an African healthcare startup company, which was started by someone from Bulawayo who is based overseas. And through this partnership, we've come up with an app. The application is an information application that is targeting our community. It allows us to engage via chat platforms, and it looks at, firstly, what is COVID-19? It gives us a breakdown of what the disease is. Then it also tells you what to do, who to contact to get assisted. So as a city, we have developed this application to allow our health workers to obtain information as well as data sets, and also share information on COVID-19.
During this coronavirus epidemic, we've seen a lot of misinformation and panic across the board. This has brought about innovation in telemedicine. For example, we've seen the World Health Organization and the Ministry of Health and Child's Care, and of course Sila Health, coming up with chat apps to try and solve this problem. We speak to Dr. Ndlovu from Pilo Hospital, and this is what he has to say.
And these apps are changing trends. They are apps that are being used to share information. If you go onto the app, you see the information. What is this condition? What is this disease called COVID-19? What causes it? The symptoms that you should be worried about. And they are interactive, so you then get to input your details. So these apps are changing the way we've been viewing health, and they are very helpful because you see they are cutting down on the numbers at the health facilities, reducing the pressure, because as people are panicking, they can simply get the information at the palm of their hands. And as they do that, we're seeing that it somehow sometimes gives some sense of assurance in terms of some of the symptoms that they may be feeling, and it provides this much needed information when there's a lot of false information that's out there. So I can say these apps are very, very helpful because they're bringing the information to the people. Of course, we also know that with anything that's new, there are also some things that will be affected. But of course, we know if there are less people who are coming with even symptoms, then it also reduces the pressure and the chances of even exposing the healthcare workers, the frontline healthcare workers, to the disease, and so that they can be properly directed to where they're supposed to go. In our case, to the COVID centers. So it's helping because it also lessens the risk of the healthcare practitioners and even interaction. Once you find that you've got the symptoms, you also call the required numbers. That helps. Of course, the negative sides is, whenever you're told about symptoms of a major condition, you start feeling them. So sometimes you start feeling and thinking that, you know what, I've got this. So sometimes it can just increase anxiety. People will think now they have it. And some also the other side, they'll actually now start thinking, you know what, because I do not have the fever that they are all talking about, or because I'm not coughing or sneezing, then I can't have this thing. Sometimes it can also bring some false sense of security. So people should still get tested when they're encouraged to get tested. As we're seeing now with the public hospitals, they're now testing centers. So people, when they are patients, they walk in and they're tested for free. So these are things that that need to also be handled carefully. So we're worried that some will get some false sense of assurance, but we also know that the positive impact is immense and is changing trends. And as to how this will affect the health field going into the future, this is happening, and there's no way that we're going to stop this. Telemedicine is the new thing, and we just need to accept it. And this is when we need to combine efforts, telemedicine technology and the medicine, making sure that information is distributed the right way, and making sure that every person who needs to see a health practitioner will see one. Because the truth is, technology can never fully replace the people. However, it has a significant role that it has to play. It will reduce the number of visits to the hospital for different people, and it will actually allow people to be treated from wherever. Like what is happening currently in the field of radiology with teleradiology. So you can find that a doctor who's in Australia can actually be on call in Canada, because when an X-ray is taken, it's just sent to their laptop or to their computer, to their computer station, in the comfort of their home even at times, and then they can interpret it. And this is where we're going. So I believe that there's a role of technology and medicine coming together and bringing something that's positive. So we need to properly harness all these two parts and bring them together, and hopefully this can only mean that people's health will be improved and things will get better and better.
We've come to the end of this week's show, and I hope you found it informative. Until the next one, goodbye for now and stay safe.